Now we're doing the easier version of a psoas stretch. We showed two different options that build to essentially what is a one-sided back bend, where they're opening the chest, the hip flexors, and psoas simultaneously.
What makes this one harder or more difficult than the other one?
There's more movement, and there's the use of your legs and feet, so that can be a bit challenging when you're new to it. But once you understand it biomechanically, it's actually much easier because your body's kept in an upright position and you're using more of your body weight.
What's one thing to be careful of when doing this, when practicing it on clients?
You always want to go slow, and you want to test their range of motion first to make sure you're not jamming. You want to be able to see long, fluid, flowing movement. So, real quick, I want you to raise your hand if you found that lifting somebody's leg was problematic. Raise your hand. Keep it up, keep it up, keep it up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Because I gave you a less effective version because I wanted to warm them up. Now, sometimes that version we just did is going to work great on the client you work with. Sometimes it's not. I'm using him as a demo because he's a larger guy. It's what a lot of you young ladies are going to deal with, right? So the way that I do this here is I could come up like this. This is still a lot of work, but I'm not fighting gravity because I'm pulling him across instead of pulling him up. How's that?
It's good.
Is that not too much?
Not too much.
Okay, so I'm going to do the even easier version. How's this? Okay. Big in-breath for me. And exhale. How's the pressure there?
Brilliant.
Okay. Not too much?
That's right where it needs to be.
Okay, if I give you a little more medial or a little more lateral, what feels good?
Lateral.
Lateral? Okay. Do you want a little bit more in the quads?
Yes.
There we go. If I give you a little pump like that, is that good?
That's excellent.
Okay. And then if I just a little bit at the end, is that okay?
Mm-hmm.
There we go. Now, do you see how I brought my body weight in? And I'm blocking him. He's not going to fall off of the table this way. Now, if I've built him up to that, and I'm going to have to figure out which foot here. There we go. Big in-breath for me. And exhale. There we go. Is that too much?
That's the money move.
That's the money move. But we built him up to this, right? We mobilized. It was after lunch. We were a little more cold. I just wanted to get some movement through there. Can I see this arm? Big in-breath for me. And exhale. Too much? Either one?
Oh, we're doing fabulous.
Yeah. And you want a little more?
Yeah.
I'm trying to get his fingers here. There we go. Big in-breath for me. And exhale. Now, psoas, but what about pecs?
Yep.
Arm. There we go.
Got my knee to pop, everything.
So, the first one, I came in with basically my sacrum just above his sacrum. Usually what I'll have to do is kind of grab his foot, and I like to wrap around the knee here. For some people, they'll be secure enough you don't have to do that, but I think it just feels a little more safe around his knee.
It feels better that way.
Yeah, and there's this little bit of like twisting motion with my torso. I'm not trying to just pull my arms, work. I'm trying to lean. And then we built up to the second one, which is putting the foot in the back. I don't think it matters which you use, if it's the left foot or the right foot. Usually I'm still going to isolate right above the iliac crest. He's a larger guy. I get a chance to use my foot and stabilize him. And you see the easier, like I'm not in a bad spine position. Let me see your arm again. And then the grip, it just depends on his shoulder rotation. I'm not trying to force. I'm trying to find what gives him a simple one-sided back bend. Big in-breath again. And exhale. Now see the little toggle, the bow? You like low or high?
High.
Okay, more high. He wants up here. There we go.
Excuse me, low.
Oh, okay.
I was backwards.
Oh, you're fine. So low. There we go. Not so much on the knee. There we go. Now, did it look like it was a lot of strain? That's what I want you to build up to. I just wanted you to be familiar with the connection and get a little bit of mobility there first before we built up to that one. I want you guys to give and receive that. Okay, if I want to focus more in our hip flexors, here's what I'm going to do. I can into the glute. Because if I'm here, to me it feels like I'm allowing the sacrum to move so I can get into psoas. But if I'm isolating in the gluteals, it feels like I'm pulling more into the front up here. Does that feel different to you? Yeah. And in the end, we can always break it down according anatomically. What I would probably do is just ask her for feedback. How's that? It's a little sharp. So here's what I do. In the gluteal this time. How's that? Just an additional option. If you don't like the foot, you don't like the knee, you could still use the elbow.